Good evening. Tonight we will be discussing the different stages and treatment options of renal cell carcinoma. This research is done in honor of my mother-in-law, Nettie Bavis, who is fighting strong against renal cell carcinoma currently. Renal cell carcinoma is the most common type of kidney cancer. This cancer begins in the lining of the renal tubes within the kidney. These tubes are used to filter the blood and produce urine within your body. Once this cancer gets in the kidney, it can be easily spread throughout the body through the blood. This cancer has 4 stages and can be recurrent. In stage 1 of renal cell carcinoma, the tumor is located in the kidney only. The tumor is under 7 centimeters during this first stage. When the tumor becomes over 7 centimeters, this will make it a stage 2 renal cell carcinoma. When the cancer progresses to stage 3, the cancer has moved out of the kidney into one of the nearby lymph nodes or possibly into an adrenal gland or the fatty tissue near the kidney. This may also move to the main blood vessels within the kidney and lymph node. As you can see in the picture, the small black marks are from the cancer moving into the lymph node. In stage 4, renal cell carcinoma, the cancer is spread beyond the one kidney, as it had in stage 3, but it is now in multiple places in the fatty tissue and in a lymph node, or in 2 or more lymph nodes. It could also be in other organs. It could be in the bowel, the pancreas, or the lungs. In the X-ray attached, you can see that there is renal cell carcinoma in the right lung of this patient. Recurrent renal cell cancer is usually a stage 4 renal cell carcinoma. This is a return after a period of time when the cancer could not be detected. One such example would be my mother-in-law. She had renal cell carcinoma in April of 2006. Her cancer returned this year in October of 2007 after being undetected on all scans until this recurrence. It may seem as though the cancer is completely gone and it returns out of nowhere. The cancer could return to the same place as the primary tumor, and it could be in other places in the body. In some instances, such as the example I just cited, there may not be the original place to return to because the kidney could have already been removed. In that case, it can spread to other places in the body, the lungs, the brain, the pancreas, through the bones, anywhere and everywhere throughout the body. There are many treatments available for renal cell carcinoma. They may not all be effective for every patient, so doctors have to carefully analyze what steps they're going to take. We're going to go through all these treatments. A partial nephrectomy, a simple nephrectomy, and a radical nephrectomy are all types of surgery. There's also radiation therapy, arterial immobilization, biologic therapy, targeted therapy, and chemotherapy. Partial nephrectomy is the simplest surgery there is. It removes a part of the kidney or just the tumor within the kidney, but it does not remove the entire kidney. A simple nephrectomy removes the entire kidney. This is what was done on my mother-in-law when she had her first bout with renal cell carcinoma. A radical nephrectomy is a surgery that can remove the entire kidney, the nearby adrenal glands, nearby lymph nodes, and other areas and tissues that are surrounding that could possibly have been infected with the cancer. Now again, this cancer can be spread all through the blood, so this is just simply trying to remove the tumors that are developing from it. It won't actually guarantee that the cancer is out of the system. Radiation therapy can be used to try to kill some of the cancer cells that are left within the body. Most radiation therapy is done with the external beam radiation, which you can see the machine in the bottom right-hand corner. This uses a high energy radiation that targets the cancer cells and shrinks the tumors. This treatment is currently being done on my mother-in-law in a tumor that is located on her spinal cord. There is also an internal radiation therapy that can be done with seeds that are planted within the body near certain tumors to help reduce them. And then the last type of radiation therapy is a systemic radiation therapy. And this radiation uses a radioactive substance such as a radiolabeled monoclonal antibody that travels in the blood into the tissues all throughout the body to try to fight the cancer through that method. Our next treatment is called arterial immobilization. What this does is it blocks an artery by clotting a foreign material, and it prevents a flow of blood from going to the tumor. Tumors' main feeding is through growing their own arteries and massive blood going through it to keep them growing and feeding and becoming larger in the body. By cutting off that flow, it cuts off the source of nutrition that's going in the tumor and begins to shrink it and keep it from being able to further grow. The next possible treatment we're going to talk about is biologic therapy. What this therapy is to help boost or restore your immune system. It's things such as getting more white blood cells. What this will do is it'll help your system fight the cancer a little bit more. It'll help fight any other infections, such as maybe an infection at the site of a surgery that was used to previously remove a tumor. It can also help and lessen the side effects from the treatment, such as dry throat from the radiation therapy or extreme fatigue from the chemo and radiation. Our next treatment is a targeted therapy. What a targeted therapy does is it attacks the cancer cells, but it does not harm the nearby cells that are non-cancerous. And one example of a drug that's used is called a monoclonal antibody. And these substances in this drug are able to very specifically identify the cancer cells apart from the normal cells. Chemotherapy is a very common drug that is heard of when people are going through cancer. It's one of the first things that comes into people's minds when they hear cancer treatment. Cancer is typically treated with chemotherapy that was given intravenously. This has very strong side effects such as hair loss, fatigue. It really wears down the patient. Luckily, there have been recent developments that have created a pill form, and this can be taken orally, which makes much less side effects. The pill form is by a U.S. brand called Sutent, and this form is clinically called a bioavailable malate salt of an iodine-based tyrosine kinase inhibitor, which basically it blocks activities of vascular growth and it drives some of the nutrition that the cells need to keep multiplying. But this has much less side effects. It's very easy on the patients in comparison with the intravenously administered chemo, which can be very harmful to the patients while it's helping them. All of the information given in this speech was found at cancer.gov, which is the website of the National Cancer Institute. If you'd like to find any more information on the treatments, the symptoms, everything about cancer, this is the place to go. And if you go to carepages.com, it is a great place to set up a family website for your family, your friends, anyone to view if you have a family member going through cancer or any other type of disease. This website helps keep your family members' mood up, which is great. It's wonderful to keep their mood up. That is one of the best things you can do during treatment. Keeping a positive attitude will help them. So overall, just to review, we went through the different treatments of cancer, which range from surgeries, which are called nephrectomies, to radiation, to arterial immobilization, to biological therapy, chemotherapy, and keeping your attitude up, which will be the most important. And there are 4 stages of renal cell cancer. There's also recurring renal cell cancer, which is within stage 4. And if you want any further information, please go visit www.cancer.gov.